Hi, friends, welcome to my YouTube channel Nursing Classes, a place where you get nursing competitive exam MCQ and theory classes. आज की इस वीडियो क्लास में हम एम्स भुवनेश्वर नर्सिंग ऑफिसर एग्जाम 2018 का क्वेश्चन सॉल्व करने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरी YouTube चैनल को सब्सक्राइब नहीं किया है तो सब्सक्राइब करें और बेल आइकॉन को क्लिक करें जिससे मेरे आने वाली वीडियोस का नोटिफिकेशन पहले मिलेगा। अगर पिछले वीडियोस नहीं देखा है तो प्लेलिस्ट में जाकर देख सकते हैं और वीडियोस के डिस्क्रिप्शन में भी लिंक प्रोवाइड करवा दूंगा। अगर व्हाट्सएप में वीडियोस का लिंक चाहिए तो पर्सनली व्हाट्सएप मी, माय व्हाट्सएप नंबर इन डिस्क्रिप्शन बॉक्स। अगर वीडियो अच्छी लगी तो एक लाइक कर देना और अपने दोस्तों के साथ शेयर करना। चलो अब शुरू करते हैं। 26. Most common symptom of alcohol withdrawal is A. Rhinorrhea, B. Bordeaux, C. Tremor, D. Diarrhea. Correct answer C. Tremor. 27. The best method to teach a patient any skills, such as using inhaler, is by A. Demonstration, B. Panel session, C. Discussion, D. Lecture. Correct answer A. Demonstration. 28. Epistaxis management includes the following actions except A. Allowing the patient to sneeze, B. Applying pressure by pinching the nose, C. Applying ice over the nose, D. Keeping the patient in sitting position with the neck flexed. Correct answer A. Allowing the patient to sneeze. 29. Which commonest fungi causes otomycosis? A. Mucar, B. Aspergillus, C. Rhizopus, D. Candida. Correct answer B. Aspergillus. 30. The most powerful stimulus for respiratory center is A. Carbon dioxide, B. Oxygen, C. Increased pH of blood, D. Oxygen lack. Correct answer A. Carbon dioxide. 31. When a patient experiences difficulty in breathing, the most appropriate position to place him in is A. Sims position, B. Lateral position, C. Fowler's position, D. Dorsal recumbent position. Correct answer C. Fowler's position. 32. Experienced nurse introducing an employee to new responsibilities through teaching and guidance is called A. Preceptorship, B. Leadership, C. Mentorship, D. Professionalism. Correct answer A. Preceptorship. 33. Visual analog scale is most widely used to measure A. Sedation, B. Sleep, C. Depth of anesthesia, D. Pain intensity. Correct answer D. Pain intensity. 34. The agent-bossed environment model of health and illness is based on the concept of A. Stage of illness, B. Infectious disease, C. Prognosis, D. Rate of exposure. Correct answer B. Infectious disease. 35. All the following are characteristics of preeclampsia except A. Vomiting, B. Hypertension, C. Edema, D. Proteinuria. Correct answer A. Vomiting. 36. Oxytocin is secreted by A. Posterior pituitary, B. Adrenal medulla, C. Anterior pituitary, D. Adrenal cortex. Correct answer A. Posterior pituitary. 37. Cell-mediated immunity is achieved by A. B cells, B. T cells, C. Neutrophils, D. Eosinophils. Correct answer B. T cells. 38. Violet blue discoloration of vaginal membrane is A. Ozinder's sign, B. Hager's sign, C. Jacquemin's sign, D. Braxton-Hicks sign. Correct answer C. Jacquemin's sign. 39. Stranger anxiety develops by the age of A. 3 months after birth, B. 6 months after birth, C. Birth, D. 8 months after birth. Correct answer D. 8 months after birth. 40. All the following are Major Jones criteria for rheumatic fever except A. Carditis, B. Migratory polyarthritis, C. Fever, D. Erythema marginatum. Correct answer C. Fever. 41. The time interval between the invasion by an infectious agent and the appearance of first sign of disease is called A. Plateau, B. Incubation, C. Exacerbation, D. Remission. Correct answer B. Incubation. 42. Posterior perineal trauma involving anal sphincter falls under A. 1 degree there, B. 4 degrees there, C. 3 degrees there, D. 2 degrees there. Correct answer C. 3 degrees there. 43. The cells of gastric gland that secrete hydrochloric acid found in gastric juice are called A. Mucus cells, B. Neck cells, C. Parietal cell, D. Chief cells. Correct answer C. Parietal cell. 44. All the following activities describes the process of valuing except A. Choosing, B. Modeling, C. Pricing, D. Acting. Correct answer B. Modeling. 45. All the following are features of severe dehydration except A. Delayed capillary refill, B. Sunken fontanelles, C. Dry oral mucosa, D. Alert mental status. Correct answer D. Alert mental status. 46. Urea breath test in exhaled breath is used to detect the presence of A. Staphylococcus, B. Streptococcus, C. Helicobacter pylori, D. Escherichia coli. Correct answer C. Helicobacter pylori. 47. The most basic quality for culturally competent nursing care is A. Learning another language, B. Recognizing the importance of family, C. Having significant information, D. Treating each person as an individual. Correct answer D. Treating each person as an individual. 48. Biochemical etiology of Alzheimer's disease relates to A. Epinephrine, B. Serotonin, C. Dopamine, D. Acetylcholine. Correct answer D. Acetylcholine. 49. All the following are major problems affecting child growth and development except A. Malnutrition, B. Common cold, C. Pneumonia, D. Measles. Correct answer B. Common cold. 50. Following are the basic skills for nursing leadership except A. Communication, B. Problem solving, C. Decision making, D. Self-evaluation. Correct answer C. Decision making. 51. Among the following, the factor that contributes to pressure ulcer is A. Edema, B. Malnutrition, C. Shearing forces, D. Chronic disease. Correct answer C. Shearing forces. 52. All the following are causes of constipation except A. Inadequate fiber intake, B. Laxative abuse, C. Decreased gastrointestinal motility, D. Decreased fluid intake. Correct answer B. Laxative abuse. 53. Korsakoff syndrome is caused by deficiency of A. Pyridoxine, B. Thiamine, C. Iron, D. Riboflavin. Correct answer B. Thiamine. 51. The average height of a newborn at birth is A. 25 to 27 inches, B. 28 to 30 inches, C. 19 to 21 inches, D. 30 to 32 inches. Correct answer C. 19 to 21 inches. 55. Perception without stimulus is called as A. Illusion, B. Delirium, C. Delusion, D. Hallucination. Correct answer D. Hallucination. 56. Partogram includes all salient features of labor except A. Pulse, B. Fetal heart rate, C. Frequency of contraction, D. Fetal presentation. Correct answer D. Fetal presentation. 57. Adjustment of living matter to other things and to environmental conditions is A. Developmental theory, B. Adaptation theory, C. General system theory, D. Physiological theory. Correct answer B. Adaptation theory. 58. The state of complete physical, mental and social well-being, and not merely absence of any disease, is called A. Care, B. Morbidity, C. Wellness, D. Health. Correct answer D. Health. 59. The drainage that consists of a large number of red blood cells is called A. Serous drainage, B. Sanguineous drainage, C. Purulent drainage, D. Serosanguineous drainage. Correct answer B. Sanguineous drainage. SART. All the following are diagnostic tests for sepsis except A. Complete blood count. B. Serum electrolyte. C. Urine culture. D. Blood culture. करेक्ट आंसर बी, सीरम इलेक्ट्रोलाइट। कैसी लगी यह वीडियो कमेंट करके बताएं। अगर अच्छी लगी तो अपनी दोस्तों के साथ शेयर करना। एंड डोंट फॉरगेट टू सब्सक्राइब। थैंक्स फॉर वॉचिंग। सी यू इन नेक्स्ट वीडियोज।